When it comes to choosing the best Medicare plan for you, make sure to check out the care, the cost, and convenience of each option. Joining me now for how you can do just that in the sponsored interview is Dr. Christopher Valentine, Medical Director of Optum. Welcome, Dr. Valentine.
Thank you.
This is an important time. We were just talking about overall in general. This is open enrollment, but specifically for Medicare, what do you suggest?
Well, with Medicare, just like it is with your plan that you maybe had through your employer, we have an opportunity once a year to really kind of make a reassessment about what kind of benefits I'm looking for in terms of coverage, additional services, prescription drug coverage, and things like that.
And this is such an important time of year because maybe you think that you're lacking something. This is the time to dig deeper and ask the questions, or maybe you don't know that what you're missing.
Right, and as we get older, we're also going through a lot of transformation as far as what our healthcare needs are, and as we're dealing with chronic illness and other issues that I work with local physicians and trying to optimize, we need to really reassess periodically about what kind of values do I have as it relates to my healthcare. Convenience, thinking about cost, thinking about what sorts of resources I need to manage some of these chronic conditions, whether it's diabetes, congestive heart failure. These things all transform, and we need to really take that into consideration when we look at those benefits.
And I look at these 3 C's, care being number 1. You do have to see, as you age, there might be something that pops up, or you are looking towards that you want to make sure is covered in the future.
Yes.
So your plan needs to make sure it's catered to that.
Right, right. I mean, when we're looking at ways that we can better serve our members, we want to make sure that we're trying to reach them wherever they're at. We want to really focus on preventative care, not just in terms of general preventative care, but preventative care around specific conditions, providing virtual care options, which is something that's relatively new, especially during the pandemic. Being able to provide a mobile clinic and other screening resources that are really going to deliver that care in order to keep you healthy rather than just simply responding when you get sick.
Well, what comes to mind is as our population ages, they might not be as mobile. So that teledoc and everything streaming might be more important than actually physically seeing the doctor. Okay, cost. You want to compare and contrast.
That's right. And, you know, I think one of the most important things is just to realize that you have a choice. And some people will have different kinds of supplemental benefit plans in addition to their traditional Medicare. And it's just important to look and evaluate and say, hey, how frequently am I going to see my doctor? And how much of a role is my deductible or my prescription drug costs going to bear into my budget? And so making that reevaluation is very important this time of year.
Okay, what about convenience? What do we need to keep in mind?
Well, keep in mind who your primary care physician is and ensure that they are in the network of the care the care plan that you are choosing, and that it's someone with whom you have a good relationship. But look at these other virtual resources as well. In addition to having urgent care services through a virtual resource, we also have behavioral health as well.
Oh, and then mobile clinics that can come, as you mentioned. How long do we have to kind of investigate if this plan is for you?
Well, right now, open enrollment, it opened up in October, on October 15th, and that runs through December 7th.
Okay, and then check the benefits, too. Maybe you need health care that includes maybe some fitness that maybe you didn't know that you could include in your healthcare plan.
Yeah, we have a number of community clinics, and we offer a number of services through the community clinics to provide, increased opportunities for activity and the like. But really, talk to your broker in order to really understand what some of those options are.
Dr. Valentine from Optum, all that information, the contact info, right there on your screen. We'll put a link on ours as well. Such an important time until December 7th.
That's right.
Thank you so much, Doctor, and thanks again to Optum for sponsoring this interview.